Hello, my name is Siddiqui. I'm a master's student at University of Calgary in the Biomedical Engineering program. I will be presenting on using focused ultrasound to induce hyperthermia in tumors. For our experiments, we made use of thermosensitive liposomes, which are drug carriers that only release their contents at hyperthermic temperatures. We use the drug doxorubicin, and its main limitation is that it's highly toxic to the heart. There are two main goals of the study. The first, to validate that the drug doxorubicin in its encapsulated form is being delivered to the tumor when used in combination with MRI-guided focused ultrasound or MRIgFUS-based hyperthermia. The second, that this method will increase the drug being delivered to the tumor. We injected CB17 SCID mice with alveolar soft part sarcoma cells, and once the tumors reached 5 to 7 millimeters, they were divided into one of 4 groups. The mice were treated with free drug or encapsulated drug with or without hyperthermia. Hyperthermia was induced for 10 minutes at a target temperature of 42.5 degrees Celsius using a transducer operating at 2.5 MHz. The mouse was placed in a half-bird-caged coil, and then the whole setup was moved into a 9.4 Tesla MR scanner. We performed treatment planning and therapy in a software called Proteus and collected T2-weighted images to check for tissue damage. Drug doxorubicin, or its encapsulated form thermo-DXR, was infused via the tail vein. 3 hours post-drug injection, the mouse was euthanized. We performed blood perfusion and resected the tumor and major organs. Drug concentration was measured by looking at fluorescence in the tissue samples because doxorubicin is a fluorescent molecule. Tumor growth was highly subcutaneous. They grew right below the skin, often close to the spine or bones. We placed a piece of chicken breast between the transducer and the skin to give a bit of height between the transducer and where the focus of heating needs to be. Here are MRI images showing thermal maps. You can see the region of interest in both the axial and coronal planes, and it is evident that heating is highly controlled and localized in the region of interest. Here are time temperature graphs showing the average temperature stabilized at 42.5 degrees Celsius. The T10 and the T90 are the 10th and 90th percentiles, and the closer they are to the average, the more homogeneous is the heating at the focus. The norm-targeted region is stable at normal body temperature. 5 of 12 mice had homogeneous heating in the focal region where difference between T10 and T90 was less than 6 degrees. For 11 mice, the temperature in the rest of the body remained stable, not changing more than 2 degrees. Finally, no damage due to heat was done in 5 mice. However, some of them had a small skin burn and some had edema formation. We found that if the focus of heating was at least 2.5 millimeters away from bony structures, we could avoid causing damage. Here is a plot of doxorubicin concentration in all of the tissues that were resected. We will first focus on the concentration in the tumors. The thermo-DXR plus hyperthermia group had the highest concentration of drug, 1.4 to 2.4 times higher than the other groups. However, it was only significantly higher than the thermo-DXR alone group. Because the focal region covered not only the tumor but a large part covered the surrounding muscle, we looked at drug concentration in the muscle and found that, once again, thermo-DXR plus hyperthermia had the highest concentration, and this time it was also significantly higher than the free doxorubicin alone group. So then, looking at the total concentration of drug in the entire focal spot, we found that once again, thermo-DXR plus hyperthermia had the highest concentration, and this time it was significantly higher than the thermo-DXR alone group as well as the free doxorubicin plus hyperthermia group. Since doxorubicin is cardiotoxic, we looked at a ratio of drug deposition in tumor versus heart and found that in the thermo-DXR plus hyperthermia group, the ratio was the highest. It was significantly higher than all of the other treatment groups. To conclude, hyperthermia can be induced in subcutaneous tumors as little as 5 millimeters in mice using MRIgFUS in a controlled manner as long as bony structures are at least 2.5 millimeters away from the focus of heating. This is less of a challenge in humans because they are larger, so the structures in their body are not in such close proximity. Since we also found drug in the surrounding skin, we can conclude that skin burns were superficial and did not penetrate through all the dermal layers as blood vessels were intact. In addition, hyperthermia in combination with thermo-DXR improves the dose ratio between tumor versus heart, which is useful when using cardiotoxic drugs like doxorubicin. Finally, this therapy did increase drug delivery to ASPS tumors and surrounding muscle, indicating that drug delivery is localized in the focal region of heating. However, experiments need to be conducted with larger sample sizes to draw conclusions about significant differences. And thank you for your attention, and I'd like to thank our funding sources for supporting this project.